Today, we announced the results from a phase 3 study in about 5,000 children under the age of 6 who'd received 2 doses of our COVID vaccine. And the really good news is we met the primary endpoints of that study, meaning that the vaccine provides the same level of protection against COVID in young kids as it does in adults. So there were about 170 cases of COVID-19 that were captured across age groups in the study. And it did give us a chance to have a look at efficacy. All of those cases, the majority of them, happened during January and a little bit of February, which we know was the Omicron surge in this country. Now, the good news is the overall performance of the vaccine showed the same level of protection against all the same endpoints as it does in adults. And so we do know vaccines in adults prevent the worst outcomes, particularly severe disease, hospitalization, and death. But we also know that in adults, vaccines after 2 doses have been less effective at preventing Omicron infections because Omicron is just that much more effective at infecting people. The efficacy we saw in children was lower, but it was about the same as what we've observed in adults after 2 doses. What really should matter most to us from a public health perspective is preventing those bad outcomes, severe disease, hospitalization. That did happen. Unfortunately, hospitals, pediatric hospitals, did see a lot of COVID-19 this last winter. And the good news is we have every reason to believe the vaccine will prevent all of those outcomes, or most of those outcomes. Just like in adults, we're looking at booster doses. In fact, in all of the age groups, we've already been studying a 3rd dose, a booster dose in adolescents, about 6 months after they received their primary series, again, just like adults. And we're going to be doing the same thing in these 2 younger age groups, so those 6 to 12, as well as the under 6s. We are going to be looking at 2 different kinds of boosters in all of the kid populations, just like in the adults. That's a 3rd dose of the prototype vaccine, the same vaccine, and a 3rd dose of a bivalent vaccine, so a vaccine that includes now Omicron. The reason we're doing that is we've seen the virus continue to evolve, and we do think it's necessary to continue to update the vaccines to reflect that viral evolution. We don't yet know whether we're going to have to update that vaccine. You have to get the data to know, but we want to make sure that if it does become necessary, that we've got the data in hand to provide an updated booster vaccine to even the youngest populations if necessary.